The National Institute of Allergy and Infectious Diseases. NIAID's mission is to conduct basic and applied research to better understand, treat, and prevent infectious, immunologic, and allergic diseases. NIAID has on-campus laboratories in Maryland and Hamilton, Montana, and funds research conducted by scientists at institutions in the United States and throughout the world. NIAID also works closely with partners in academia, industry, government, and non-governmental organizations in multifaceted and multidisciplinary efforts to address emerging health challenges such as the H1N1/09 pandemic and the COVID-19 pandemic. NIAID traces its origins to a small laboratory established in 1887 at the Marine Hospital on Staten Island, New York. Officials of the Marine Hospital Service in New York decided to open a research laboratory to study the link between microscopic organisms and infectious diseases. Joseph J. Kinneum, a medical officer with the Marine Hospital Service, was selected to create this laboratory, which he called a Laboratory of Hygiene. Kinneum's lab was renamed the Hygienic Laboratory in 1891 and moved to Washington, D.C., where Congress authorized it to investigate infectious and contagious diseases and matters pertaining to the public health. With the passage of the Ransdell Act in 1930, the Hygienic Laboratory became the National Institute of Health. In 1937, the Rocky Mountain Laboratory, then part of the United States Public Health Service, was transferred to Division of Infectious Diseases, part of the NIAID. In mid-1948, the National Institute of Health became the National Institutes of Health with the creation of 4 new institutes. On October 8, 1948, the Rocky Mountain Laboratory and the Biologics Control Laboratory were joined with the NIAID, Division of Infectious Diseases and Division of Tropical Diseases to form the National Microbiological Institute. In 1955, Congress changed the name of the National Microbiological Institute to the National Institute of Allergy and Infectious Diseases to reflect the inclusion of allergy and immunology research. That change became effective on December 29, 1955. The following have been directors of the National Institute of Allergy and Infectious Diseases. NIAID is composed of the Office of the Director, 4 extramural divisions, and 3 intramural divisions. The Dale and Betty Bumpers Vaccine Research Center is composed of 4 laboratories and 2 programs. NIAID's research priorities are focused on. NIAID's mission areas are. NIAID has established a reputation for being on the cutting edge of scientific progress both through its intramural labs and through the research it funds at academic institutions. For example, NIAID collaborations with various partners led to the development of FDA-approved vaccines for influenza. NIAID also was instrumental in the development and licensure of a cellular pertussis vaccines, conjugate vaccines for Streptococcus pneumoniae and Haemophilus influenza type B or HIP, and a preventive therapy for respiratory syncytial virus or RSV, and norovirus. NIAID has done research on mother-to-child transmission of HIV. In 1994, a study co-sponsored by NIAID demonstrated that the drug AZT, given to HIV-infected women who had little or no prior antiretroviral therapy, reduced the risk of MTCT by 2/3. In 1999, an NIAID-funded study in Uganda found that 2 oral doses of the inexpensive drug nevirapine, one given to HIV-infected mothers at the onset of labor and another to their infants soon after birth, reduced MTCT by half when compared with a similar course of AZT. Subsequent clinical trials, including some funded by NIAID, showed that AIDS drugs also can reduce the risk of MTCT through breast milk. These and other studies have led to World Health Organization recommendations that can help prevent MTCT while allowing women in resource-limited settings to breastfeed their infants safely. More recently, NIAID-funded scientists found that testing at-risk infants for HIV and then giving ART immediately to those who test positive dramatically reduces rates of illness and death. HIV-infected infants were 4 times less likely to die if given ART immediately after they were diagnosed with HIV, when compared with the standard of care. This finding helped influence the World Health Organization to change its guidelines for treating HIV-infected infants. The guidelines now strongly recommend starting ART in all children under age 2 immediately after they have been diagnosed with HIV, regardless of their health status. NIAID offers 3-year fellowships for medical trainees in allergy, immunology and infectious diseases. These Accreditation Council for Graduate Medical Education accredited fellowships provide intensive clinical training and research mentorship in clinical and basic science laboratories. Both NIAID fellowship training programs include 1 full year of clinical responsibilities, including 2 or 3 Mont.